Hi everyone, I'm Paige Abbott. I'm a registered psychologist in Alberta, and I just like to provide a quick disclaimer to remind you that self-help videos like this are not a replacement for professional assessment and treatment. If you are really struggling, I would encourage you to find a provider in your local area who can provide you adequate support and care. Now on to the topic for today. I recently wrote a blog post about the top 5 areas that addiction manifests in beyond and besides drugs and alcohol. I feel like in society we're still caught up in this idea that addiction equals unhealthy drug and alcohol use. And I've worked in the area of addiction for 9+ years, and I can say unequivocally that is not the case. There are many, many people out there who are struggling and suffering with addiction. Yes, some of them do have problematic drug and alcohol use, but some people come in exclusively for other issues where they're struggling. And it's unfortunate they've struggled for so long and haven't been able to receive proper care because nobody is willing to acknowledge that these are addiction-related issues. And so other diagnoses get thrown at them, but they don't really capture the essence of the problem. I would encourage you to check out the full blog post because that one covers the top 5. This video today, I'm going to cover the top 3. There's also more information in that blog post about the brain, kind of what's going on in the realm of addiction that I'm not going to get into in too much detail today. But I hope that you will self-educate yourself and learn more about what is happening in the brain of someone who has addiction compared to someone who does not. So what are the top 3 areas? This is based on anecdotal evidence and observation over these years of practice. Where are they? Well, I'd say the top 3. Number 1, top 3, and these are in no particular order. Number 1 is food. A lot of people are familiar with the term eating disorders, which I would say is equivalent to addiction. However, some people still maintain that an eating disorder is a different process experience than someone with addiction. Honestly, I think this is still rooted in that fundamental myth and assumption that addiction equals drug and alcohol use, and hence people's reluctance to put an eating disorder and addiction into the same category. But nevertheless, when you really start to explore what is going on in the mind, the thinking, the feeling, the behavior of someone with an eating disorder, if you compared that to someone with unhealthy drug and alcohol use, you will find many of the same features, just connected to a different behavior. All of them are rooted in that fundamental desire for escape or relief and or reward. Some people fall more on one side of that spectrum than the other. Some people's minds bounce back and forth between the two. Both can also be unhealthily driven by a desire for control, avoidance, a way of quote-unquote coping with stress, with difficult feelings and situations, and both result in basically that behavior taking over people's lives. It becomes the fundamental priority and driver for people, even though that's not necessarily what they want. It may start off being appealing, and I hear that with people who struggle with substances as well as with food-related issues, that initially there is that hit, there is that obvious intoxication that people like. They have that obvious sense of reward. But often as time progresses, that becomes less and less, and people are left with the painful consequences and reality of living with these chronic conditions rather than the hit or the high or the reward that it initially came with. So food is a very key and critical area. Again, some people seek out help exclusively for issues with food, whereas others may present for counseling and help for other behaviors. So they may present for drug and alcohol concerns or other behaviors. But I would encourage anyone who has a known issue with addiction of any kind to also look at your relationship with food. A quick little bit of brain science. I know I said I wasn't going to do much today, but just a little bit. The part of the brain, the reward circuitry that drives our behaviors, including with food, drugs, and alcohol, is our core circuitry that drives our basic survival needs. So that pertains to food, sex, and basically those are the main ones, but that can go into other areas as well related to our basic needs for survival. So that's the reason that if people notice they have addiction in other behaviors, it is that circuit that's been impacted, and therefore to think that there aren't related impacts on the areas of food as well as sex, I think is a misunderstanding of what's actually going on and the condition that you have. So for people who have addiction of any kind, please do look at your relationship with food, because addiction is likely to still be very active in that area, even as you're trying to engage in recovery efforts for the other behavior where you're struggling. And I find it's just a compassionate and a realistic way to go about your recovery and that self-care plan. Number 2 area, I basically said this in point 1, is sex. This is because that reward circuit controls those basic needs for survival, which are food, and the need to procreate, which is related to sex. So this is again another area where some people notice that's kind of what seems like the exclusive way that their addiction and unhealthy behavior manifests. Whereas for others, it may almost be kind of a tag along to some other behaviors or substance use that's extremely problematic for them. Much like with food, I do encourage everybody who knows that they have addiction in any form to also explore their relationship with sex. Because again, to think that that's not being impacted by the brain condition that you're experiencing, I think is a misunderstanding and can result in a lot of challenges to your health and to your recovery. Meaning, if you're trying to put out a fire over here, which is that main behavior that you're struggling with, you're engaging in all of these recovery efforts, but from over here, there's still glasses of gasoline being poured on that fire through your relationship with food or with sex. How effective is it going to be to try to quiet down that burning fire? Well, you're going to keep resulting in frustration, and there's going to continue to be more activity with that than you would hope or like to see. So if you're really engaging in your recovery and feeling like you keep hitting these ceilings or these walls, chances are that there's other behaviors that are still being engaged with by that addiction part of the brain that haven't been addressed. So here's a top 3 list of things that I would strongly encourage you to look at. So to recap, top 3 areas: number 1 is food, number 2 is sex, and number 3 is relationships. Relationships are sort of related to sex in that we do need some degree of connection in order to get to that step of sex. So meaning that this is connected to that basic core survival circuitry that we're connected human beings. We need and value and thrive on connection, but connection can kind of make or break health depending on how we're approaching it, who we're engaging with, and how we're engaging with people. A lot of times addiction in relationships people will call codependency. So if that's an area that you're open to looking at, that might be a really good pocket of resources to start exploring. Sometimes people come across a more limited definition of codependency, meaning that codependency is only when you are caretaking for someone who's unwell. So often and historically, codependency has been attributed to people who are caregiving or caretaking for somebody with addiction. I would expand that and say addiction in relationships has way more features and symptoms than simply that caretaking. Not that that's a simple thing, it's complex in and of itself, but addiction in the brain, the directions that it can go are pretty multitude and pretty endless. So what else can addiction in relationships look like? Well, it can take a variety of forms. It can look like codependency. It can look like total independence and isolation. It can look like caretaking. It can look like control, enabling, difficulty with boundaries, difficulty in communication, difficulty in kind of emotional intelligence and expression of feelings and self. It can result in aggressive, abusive behavior. It can result in very passive, avoidant, kind of victim-driven sorts of behavior. There can be a real push-pull. Sometimes it can be almost relationship binging, using people like a drug for escape, relief, reward, validation, approval. It can also flip over to the other side of relationship anorexia. So fear of relationships, avoidance, isolation, control, really closing people off from intimacy. Some of these symptoms in and of themselves may just seem like part of our programming related to maybe trauma that you've experienced in your past, and certainly those are complicating factors. But again, coming back to the point that if you especially have noticed this obsession, compulsivity, difficulty with balance and moderation in other parts of your life and behavior, then chances are you are exhibiting some vulnerabilities, if not the overt manifestation of addiction. And it would be worth exploring these other areas to see what other symptoms are coming out of that part of the brain that's driven for a very strong kind of over attachment to things. We all need healthy attachment, but that's unfortunately what addiction does, is that it takes things too far. So it takes our natural drives, it takes our natural personalities and pushes them to such an extreme that they become harmful and dysfunctional rather than the functional strengths that we would hope them to be. So to recap, what are the top 3 areas that I've observed that addiction impacts after drugs and alcohol or beyond drugs and alcohol? They're food, sex, and relationships. And I hope that all of you, even if you don't identify having addiction, we're all vulnerable to it in some way. Most of us have a relative not too far down the line that has that gene that has maybe been passed down to us. And so I think all of us, just for our health as human beings, is worth exploring our health and our balance and our boundaries in all of these areas. So I appreciate you watching. I appreciate your kind of vigilance and determination to look after yourself and to keep exploring, keep growing. And these are some very significant areas worth exploring. It'll take a lot of time, a lot of work, a lot of reflection, talking, learning. But I can say it's definitely worth it because it'll increase and improve your quality of life. And these are the fundamental areas of being a human being. So I hope that you will do more with these and explore them for yourself because you're worth it and you deserve that. Thank you so much for watching. Again, if you're curious what I put as the next 2 other ways that addiction manifests and impacts people beyond drugs and alcohol, check out my blog post. I'll put the link in the description and you can go from there. Thanks so much for watching. Take care for now.